Immunotherapy for colon cancer. What are biomarkers? Imagine a treatment that uses your own immune system to fight cancer more effectively. That's what immunotherapy aims to do, especially in colon cancer. But not everyone benefits equally, and that's where biomarkers come into play. Biomarkers are measurable indicators in your body that can help predict how well you might respond to immunotherapy. They act like clues that guide doctors in choosing the best treatment options for each patient. The most well-established biomarkers for colon cancer immunotherapy are called Microsatellite Instability-High and Mismatch Repair Deficiency. These are fancy terms, but they basically mean that the tumor has a lot of genetic mutations because of errors in DNA repair. When these errors happen, the tumor produces abnormal proteins called neoantigens, which the immune system can recognize and attack. Tumors with high microsatellite instability or mismatch repair deficiency tend to respond very well to immune checkpoint inhibitors like pembrolizumab and nivolumab. These drugs have been approved by the Food and Drug Administration for treating metastatic colon cancers with these features. Testing for MSI-H or dMMR is routine now and is done using special lab techniques called immunohistochemistry or genetic sequencing. Another biomarker that can give clues about immunotherapy response is called programmed death ligand 1 or PD-L1. This is a protein found on some tumor cells and immune cells that can suppress immune responses. Measuring PD-L1 levels involves a test called immunohistochemistry. While PD-L1 testing is common in other cancers like lung cancer, its role in colon cancer is less clear. It can sometimes help provide additional information but isn't the main factor in deciding treatment. Tumor mutation burden is another biomarker under investigation. It refers to the total number of mutations in a tumor's DNA. Tumors with high mutation counts may produce more neoantigens, making them more visible to the immune system. While high tumor mutation burden alone isn't enough to predict response, it can be useful when combined with other factors like MSI status. Some tumors that are microsatellite stable but have high mutation counts have shown responses to immunotherapy. Immune cells that infiltrate the tumor, called tumor-infiltrating lymphocytes, can also provide insights. A high presence of these immune cells often indicates that the immune system is already engaged with the tumor, which might mean immunotherapy could work better. However, testing for TILs isn't yet standardized in clinical practice. Researchers are also exploring other potential biomarkers, such as circulating tumor DNA, immune cells in the blood, and even gut bacteria profiles. These emerging markers could someday help refine how we select patients for immunotherapy. In everyday clinical practice, testing for MSI-H or dMMR is standard for all colon cancer patients because it's the most reliable predictor of benefit from immunotherapy. Other markers like PD-L1 and tumor mutation burden can provide additional clues but are not yet routine for making treatment decisions. Understanding these biomarkers helps personalize treatment plans, giving patients the best chance for success while avoiding unnecessary side effects from ineffective therapies. If you or a loved one are considering immunotherapy, it's important to discuss biomarker testing with your healthcare team. They can interpret your tumor's specific characteristics and recommend the most appropriate treatment options. Remember, each person's cancer is unique, and treatment plans should always be tailored to individual needs. Immunotherapy offers hope for many, but its success depends on understanding these biological indicators that reveal how your cancer might respond.